As part of ongoing efforts to strengthen St. Lucia's health surveillance capacity for early detection and response to public health threats, the Ministry of Health, Wellness and Elderly Affairs recently launched the National Event-Based Surveillance System. The Event-Based Surveillance System is designed to incorporate an unstructured way of identifying and assessing reports of potential health threats from the level of the community and social media alerts. Chief Medical Officer Dr. Sharon Belmar-George hailed the launch of the system as a significant moment in the journey towards strengthening health security and protecting the well-being of the community.
In a world of increased travel and trade, health threats can emerge at any time, which we have been seeing over the last few years. No disease is specific to one region. Event-based surveillance allows us to hear and to receive in a timely manner the concerns of the public through informal channels, which may be community reports, media monitoring, social platforms, often before our traditional systems take place. And this is one of the things which we have been doing, but on a very small scale. So now we will have an organized mechanism or framework to allow us to get that information in a timely manner.
The launch of the event-based surveillance system won a positive reaction from the Permanent Secretary in the Ministry of Health, Jenny Daniel, who reminded stakeholders of their responsibility to ensure the system is a success. Ms. Daniel also highlighted the role of every citizen in health surveillance and the part they play to mitigate public health threats on island.
Today, we recognize that surveillance does not begin in the clinic or in the laboratory. It begins in the community, in the schoolyard, in the market stall, in the poultry coop, in our homes, where events unfold and patterns emerge long before they reach the attention of our healthcare providers. This is why the events-based surveillance is so powerful. It allows us to capture health threats at the earliest signs, not only through traditional channels, but through community-driven alerts. It enables us to act faster, to investigate sooner, and to intervene more effectively, thereby safeguarding not only human health, but also animal health and our shared environment.
The preparation and implementation of the event-based surveillance system was made possible through the technical support of the Pan American Health Organization, PAHO. PAHO Advisor for Health Surveillance, Disease Prevention and Control, Dr. Prabjot Singh, commended St. Lucia for strides made in utilizing digital tools to monitor informal sources of potential health threats.
That is building on the leadership that St. Lucia has shown in information systems. You already have almost a paperless system with the implementation of SLU HIS. Now you're going towards with the implementation of DHIS2, which is going into complaints, which is a novel thing because we had not as yet tested to use this platform for event-based surveillance. And on this, I think St. Lucia is the only and the first Caribbean country to go to have a platform which is digital for event-based surveillance. And on that, I would like to commend you.
Leading up to the launch of the event-based surveillance system, the Pan American Health Organization, PAHO, hosted a workshop with key stakeholders to provide them with a better understanding of the principles and mechanisms of the system. The stakeholders who benefited from this workshop included representatives from essential sectors such as health, education, agriculture, environment, disease management, border control, civil society, and the media. Reporting from the Ministry of Health, Wellness and Elderly Affairs, I am Funnel